Good evening, everyone. Thanks so much for being here. Really appreciate everyone coming and attending this webinar that's put on by the New Hampshire Healthy Climate Group. Um, One thing that I'd like to just quickly, before we get to our speakers, remind everyone in the audience to please make sure that they're on mute, and you can make sure that's the case by looking at the little audio icon in the bottom left and making sure that red X is running through it. Um, I also just want everyone to know that during this recording, or during this webinar, it is being recorded and it will be posted later to both our website and YouTube channel for those who want to watch it another time. Um, Before we get to our speaker, one other thing that we like to acknowledge here at New Hampshire Healthy Climate is that although this talk is virtual, it does take place on the ancestral lands of the Pennacock, Abenaki, and Wabanaki peoples. And we acknowledge with both honor and gratitude the land, water, air, flora, fauna, and the people who have stewarded this land throughout generations for 12,000 years. But with that, I'd really like to get to our speaker, who's going to give us a very timely presentation. I'm happy to introduce Dr. Lindsey Burghardt. Dr. Burghardt is the Chief Science Officer at the Center on the Developing Child at Harvard. There, she develops and leads the center's scientific agenda. She's the founding director of the center's Early Childhood Scientific Council on Equity in the Environment. This is a multidisciplinary group that synthesizes and translates scientific mechanisms related to the many ways that the built and natural environments impact children's development and lifelong health. She engages regularly in presentations and conversations with diverse stakeholders to communicate this science to a variety of audiences with the goal of making it accessible and actionable. In addition to all that great work, Dr. Burghardt is also a practicing primary care pediatrician outside of Boston. She's board certified in both pediatrics and pediatric emergency medicine. And with that, Dr. Burghardt, I'll leave it to you.
Thank you, Dr. Walsh, and thanks to New Hampshire Healthy Climate for having me. It's really nice to be here virtually talking with you all. I'm going to take a minute to share my screen and we'll get started. All right, so we should be all set there. So my presentation today is called What Surrounds Us Shapes Us, and we're going to talk about how wildfire smoke affects early childhood development and health. So to start, I just briefly want to mention the Center on the Developing Child and our work in this space so you can have a little bit of orientation to what we do. The center is an interfaculty initiative at Harvard. We sit between the Graduate School of Education and the T.H. Chan Harvard School of Public Health. And our mission really is to leverage what the power of science tells us in pursuit of better outcomes for young kids, especially those facing significant adversity. And our goal really is to bring this scientific understanding to policymakers, to other audiences, anyone really where we can help to shift mindsets around how important it is to support healthy development during pregnancy and the first few years of life. And so we hope that when we do this, we can catalyze changes in policies and services and in funding that really ensure that all kids can thrive, along with their caregivers in environments that support their healthy development. So today we're going to discuss the science of early childhood development as it relates to wildfire smoke. And then I'd really love to spend a lot of time talking about solutions, things that we can all do, no matter where we sit, to protect children from the effects of wildfire smoke. And then also some early work that we're doing with some of our partners on how we can effectively communicate as advocates about the connections between children and climate change, including wildfire smoke. So I know that we're coming from a lot of different healthcare backgrounds tonight. Tommy and I are pediatricians, but I know that there's many in the audience who might come from other backgrounds in medicine and healthcare. And so I want to make sure that we're starting from a common understanding of what influences children's development. And so we want to start, it's really helpful by broadening the lens and taking a really broad view of development and what influences it. So in young kids, it actually begins well before they're born. And early in the earliest days of the prenatal period, kids' development is actually shaped by the full range of all the exposures and all the experiences that they have in the places where they're living. So this is their social environment, but it's also their built natural environments. And when you take all these things together and look at them as a whole, we call this in pediatrics the developmental environment. Now, in early childhood and in that prenatal period, kids' biological systems are really rapidly developing and they're super sensitive to the environments that are around them. They're constantly reading the environment and they actually develop in response to what they read. And so, in the prenatal period and early childhood, for example, the lungs and the immune system develop really rapidly in a really interconnected way. And so, when kids are exposed to certain types of air pollution, for example, let's take the case of wildfire smoke, but think of other types of air pollution, the lungs and the immune system adapt. They read that environment and they go through pathways that include things like inflammation and altered immune system development. And then short term, this is super protective because it helps to like clear garbage and debris out of their lungs and it traps pollutants so that they can't get into the deeper airways. But then when this inflammatory response happens over a long period of time, it increases the risk of developing asthma later in childhood. So the experiences that young kids have, again, when I say young, I mean beginning in the prenatal period, that are part of this developmental environment, they can have negative effects, but they can have positive effects too. So if we think about positive exposures, these can fuel healthy development. Think about breathing clean air or having a comfortable temperature where you sleep. So these negative experiences and exposures like wildfire smoke can derail healthy development. So other examples might be things like drinking water contaminated with lead or being exposed to extreme heat. So these developmental environments are really important to understand because they shape a wide range of outcomes, not only in childhood, but actually across children's lifetime. So they affect the adults that children become. And this includes their physical health, but also their mental health and their learning, their social emotional well-being. And so by really changing and redesigning environments where kids live, we actually can alter the experiences and the exposures that they have to help support their healthy development and better outcomes. So if we start to look closer at what makes up developmental environments, it can help us understand why it matters so much where kids live in terms of what they're exposed to. So in the pediatric community and in the early childhood sector, we focused for a long time, rightly so, on the adult-child relationship. So the relationship that children have with their caregivers. And these foundational relationships are super important. They're not any less important now, but caregivers are not raising young kids in isolation. So these conditions in the environment where where kids live are also really powerful in shaping their lifelong health. And so this is important to bring into this talk because when we think about the solutions for protecting kids and for supporting families, there's a much broader range of policy domains that we can think about bringing to the table that contribute to learning and health beyond those of us in healthcare and pediatrics and beyond those in what are thought of as traditional early childhood systems. So when we think about the built environment, we're talking about everything from the residences and where people live, how dense the surrounding buildings are, what type of businesses surround them, whether they offer access to nutritious foods. And then the natural environments, everything like the quality and temperature of the air that you breathe, how pure is your water supply, how available is it to you, and how is climate change coming in and shaping your neighborhood. So these things together, we can help us understand that where people live, actually, where young children live, affects what they're exposed to and the types of experiences that they have. And that's really powerful in affecting their developing biological systems. So we're all sensitive to our environments and we're all sensitive to wildfire smoke, but development is a process that evolves in ways that make certain age ranges really especially sensitive to environments and exposures like this one that we're talking about today. And so what this means is that these experiences are really powerful when they occur early. Now, in general, the sensitivity in the prenatal period of development is greater than the sensitivity in the first few years of life. But young kids, those who are a year, 2 years, 3 years, 4 years old, are in general more sensitive than most adolescents. And adolescents are more sensitive to a lot of these exposures than a lot of adults. And so this differential sensitivity is part of what is going to make the effects of wildfire smoke on children that we talk about unique. And so if we take the example of wildfire smoke, although we could extrapolate this and talk about heat or water, a variety of other exposures, the outcome that occurs in young children when they're exposed depends on actually the timing during development when the exposure occurs. And so prenatally, we'll get into this in more detail, but just to give an example, exposure to wildfire smoke can lead to outcomes like a heightened risk for being born premature or too early. But if you're exposed in infancy, that can heighten your risk of wheezing. And if you're exposed in middle childhood as a 7, 8, 9-year-old, that can actually contribute to learning loss in school. So this is again the differential sensitivity of different points in development. So it's really exciting because pediatric science and developmental science is not only helping us to understand how these exposures work, but it's actually revealing what we need to do to make our solutions work better. So science is pointing us towards both solutions and when we need to step in. Now, there's a good news, bad news here, right? Because of the sensitivity of this time, any negative exposures, including wildfire smoke that happen during these really early periods, are going to have a heavy and negative outsized effect on all of the outcomes that we care about. But then the converse is also true, right? There's another flip side of that coin that we can really use in our efforts to advocate for young children. If you protect people during pregnancy and very early in childhood, we also have an outsized positive effect on all those outcomes that we care about. So we talked about developmental environments influencing development and shaping biological systems. Climate change is a really important force that's coming in and shaping kids' developmental environments. So the way that you experience climate change, in large part, depends on how your neighborhood was designed. This also is true in terms of your social environment. It's coming in and affecting the way that caregivers are able to take care of kids. So when we think about climate's effect on kids, including wildfire smoke, there's two big categories of effect. The first is direct. So this is things like more kids are developing asthma and having flare-ups of their asthma because they're exposed to wildfire smoke or because they're exposed to extreme heat. But then there's a really important bucket of indirect effects, like wildfires resulting in housing displacement for thousands of kids and school closures and lost learning and missed school meals. So we saw this, for example, after the January 2025 wildfires in the LA area. There were widespread school closures, significant damage to a number of schools, and it impacted over 700,000 kids. So not only were a lot of these schools damaged or destroyed, but many more of them were actually closed because of evacuation warnings, and there were power outages and smoke. So this lost learning has really important implications, and not being able to get meals that you count on has additional trickle-down implications for your family's economic situation. So I want to bring up just broadly that there's three categories that we need to think about. We're talking about air quality today with wildfire smoke, but here I really want to mention effects on temperature and water too, because when kids experience wildfire smoke, they don't experience it as a single exposure. They're not just exposed to smoke. They're also experiencing hotter temperatures than ever and a variety of effects related to water over and under supply from climate and contaminated drinking water that results from extreme wet weather events that have effects on our drinking water supply. And so the good news here is that a lot of the solutions we have, say to target wildfires, have benefits across multiple domains of these effects. So for example, strategic tree planting can help to improve resilience against wildfires, but it also is really good at lowering temperatures and improves air quality. It provides resilience in extreme wet weather events. And then trees just have an incredible range of positive benefits across a range of children's development. So let's start by talking about air pollution because wildfire smoke and air pollution are sort of obviously closely related. The reduction of air pollution in the US until recently was actually a big success story, and maybe we don't one that we haven't talked about enough. The Clean Air Act was originally in 1970. They did a couple of major updates, one in 1977 and another in 1990 that were both in response to new data. This act really reduced outdoor air pollution from a variety of sources, actually more than 70%. It saved trillions of dollars in healthcare costs. And even during that time, as it was saving money, the population was getting bigger, the economy was growing, there were more cars on the road. All those things were growing substantially. Now, the impact of the act was pretty impressive and borne out in the literature. So, throughout 2020, the act was estimated to prevent 2.4 million days of worsened asthma symptoms, over 100,000 emergency room visits that would have happened, over 5 million lost school days that would have occurred, 200,000 heart attacks that didn't happen, and more than 230,000 premature deaths that didn't occur. However, the wildfire smoke that's happened recently, fueled by extreme heat and excessive drought brought on by climate change, has really driven an increase in several types of air pollution and caused a really significant deterioration in air quality in three-quarters of the contiguous United States. So effectively, the effect of wildfires have erased 4 years of air quality progress that we made in decreasing these pollutants. So before we start to discuss the unique effects of wildfire smoke on kids, it's really important to start by understanding how it affects all of us. So the year 2024 set, I think many would agree, unprecedented records for global temperatures, right? We passed all the previous highs. And the extreme heat also contributed to the most extensive and the most numerous wildfires that were ever recorded across the globe, and these continue. But also in the last 2 decades, there's been an increase in this intensity of what we call extreme wildfires. So these are not small, they're the ones that have really significant social effects, they have economic impacts, they have ecological impacts, and there's beyond the limits of our fire control. These severe fires have more than doubled. And we've seen the Western United States experiencing a particularly sharp increase, but we had wildfires not far from my children's school in the suburb of Boston earlier this year. So they're happening in more and more places. And again, climate change has fueled this growth in a number of ways. The droughts are making the trees just drier and more flammable. So even if the cause of the fire is an outdated or faulty electrical system, there's more flammable kindling available. The heat, extended heat has made the plants less resilient, so they burn more easily. The higher temperatures also increase the viability of an invasive beetle species that kills the trees, again, more fuel for the fire. And so, because of these changes, the wildfire smoke is really affecting millions of us on a daily basis. Now, the good news here is that with experience comes the learning of many communities that there's already a lot of solutions that are being implemented to good effect, and we'll get into those in a little bit. So wildfires have really acute, immediate effects, and they have effects for the communities right adjacent to where they occur. But wildfire smoke can travel for thousands of miles from the source and still be really highly toxic. And you may have heard, but wildfire smoke is thought to be at least 10 times more toxic than airborne particles from other sources like factory emissions or auto emissions or cigarette smoke. So if we have a fire that occurs at what we call the wildland-urban interface, that's sort of the border between where trees are burning and where person-made structures are burning, then it's also going to be consuming buildings, gas stations, landfills, industrial facilities, upholsteries. You think of it, anything you can imagine that exists in a community. And that smoke then actually becomes even more toxic because it carries what we call particulate matter. It also carries a group of compounds called volatile organic compounds, or VOCs, you may hear them referred to. These are chemicals that are usually in household products, so things like paints and cleaning supplies. They also carry heavy metals, so think about arsenic, lead, cadmium, mercury. And these things are in other types of air pollution too, but they're in much higher concentrations in wildfire smoke. And actually, the toxic metals, when they burn in wildfires, they actually stick to pieces of ash and dust that get kicked up. And so these float in the air and then they get inhaled. So if we take an example, there's California cities that were affected by smoke from the Camp Fire in 2018. They measured lead levels in the air that were 50 times higher than normal during that fire. So then what happens after the fire is that the heavy metals, like lead, that are in the air and in the ash, are then deposited in the soil that's around homes, it's in schools, it's in playgrounds, and then it contaminates the water supply. So months after the Maui fires that were in 2023, there were really dangerous levels of arsenic, of lead, cobalt, there's copper. That was all due to the wildfire smoke ash that had settled in that affected area. So, again, there's these particles are in the ambient, air that we breathe every day. But what makes wildfire smoke so toxic is the combination of the higher concentration of the particles in the air during and after the wildfires, and the difference in the chemical makeup of what's in the particles that form during the fire. And what makes wildfires in part difficult to study is that the different materials that are burning actually lead to different types of particles depending on what's burning. And then this can lead to different types of health harms. But really, all these pollutants have the ability to cause negative consequences for kids' development and health when they enter the body. And then when we think about wildfire smoke combining with other harmful exposures, think about those emissions from factories, if you live next to a highway, if you have toxic chemical waste, if it's extremely hot out, there's these compounding effects that I talked about earlier that are really especially harmful to kids. But if we think about and develop a strategy to protect people from wildfire smoke during pregnancy and during early childhood, it's really this critical opportunity to improve their lifelong health and well-being. So really interestingly, wildfire smoke, of course, it begins outdoors, but it's really important to understand that it very quickly gets inside buildings through leaky windows, invisible cracks, through ventilation systems that don't have high quality filters. There's also high winds and smoke can carry the ash and smoke into buildings, even if the buildings aren't burnt down. So after the Marshall Fire in Colorado in 2021, there were wind gusts that were like 100 miles per hour. And this caused the fire to spread into a residential area. But then for like 2 miles outside of the fire boundary, they were finding elevated levels of ash and dust in homes. And people in those homes were reporting more headaches, respiratory symptoms, and itchy eyes. And these physical symptoms were more common in families that reported that the ash and dust had been identified in their homes, even if the homes hadn't burned down. So wildfire smoke has effects on all of us, but it has really especially powerful effects on babies and young children. And not only are babies and young children exposed to more indoor air pollutants because of their physiology, but they're also more affected. So they breathe more rapidly than we do. So they inhale actually more air relative to their body size than you and I do. And their respiratory systems, their endocrine systems, their reproductive systems, their digestive systems, their brains, they're all still developing and they're developing really rapidly. And so again, this is the flip side to the sensitivity is that it's a really powerful opportunity for protection. The earlier we can step in to protect kids, the more we can have these outsized positive effects on their outcomes. So we'll get into three categories of effects now of wildfire smoke on babies and young children. The first is the effects on fetal development. Then we'll talk about some respiratory issues, and then interestingly, the effects on learning loss, and then we'll get into solutions. So it's important to understand how wildfire smoke affects pregnancy because these effects have really important implications in the moment, the health of the pregnant person and of the fetus, but they also have really important implications for health and development across a child's lifespan. So when airborne particles and chemicals pass through our lungs and into our bodies, they trigger our immune system to respond. Now, inflammation is super important. It's an important part of immune response. It protects our bodies. It protects us from those trapping those physical particles that I talked about earlier and those toxic components that are absorbed on the particles. That short-term response is helpful. But again, when this inflammation happens for too long, especially when it happens during these sensitive periods of development, when the brain is still developing, it actually can weaken the immune system and it can lead to lifelong inflammatory conditions. So think about everything from heart disease to diabetes to autoimmune disorders. And exposure to wildfire smoke during pregnancy can actually have a really significant negative impact on healthy birth outcomes. It's Preterm birth is a really what we call heterogeneous outcome, meaning there's a lot of different things that contribute to it. And we talked about wildfire smoke having the potential to be made of a lot of different things. So there's many smart people out there still really working to understand exactly how wildfire smoke leads to increased rates of preterm birth. But it's thought that it's possible that the smoke can trigger the body's inflammatory response. And this may be also what leads to higher rates of gestational hypertension in pregnant people who are exposed, as well as higher rates of preeclampsia and preterm birth. Now, these effects are not insignificant. This is a substantial number of preterm births. There's one California study that looked at an estimated nearly 7,000 excess preterm births. So, in addition to what would be expected, attributable solely to wildfire smoke in a 6-year period from 2006 to 2012. Now, the effects of a lot of different air types of air pollution on pregnancy are really well known. They've been studied for a long time by a lot of different people. And again, still working to really understand how wildfire smoke specifically affects pregnancies and birth outcomes. But wildfire smoke increases a type of air pollution that's known as particulate matter 2.5. You'll hear it referred to as PM 2.5. This is a type of air pollution that's very, very small. So it's referring to particulate matter or liquid droplets with a diameter of 2.5 microns or less. So we're talking like 20 to 30 times smaller than the diameter of a human hair. And these particles are so small that they can enter the respiratory system, travel to the smallest parts of our lungs to the alveoli, and then pass from the respiratory system into the bloodstream. Now, up to half of the PM 2.5 in the western part of the US has been linked to wildfires. So while these studies aren't specific to wildfire smoke exposure, it's really reasonable, I think, to take what we know about PM 2.5 and what scientists have learned about the effects of this exposure and use it to inform our thinking about how wildfire smoke might be driving these preterm births. There's also a type of PM 2.5 called black carbon. It's also referred to as just soot, and that's actually been identified in fetal brain tissue. So it's hypothesized that this type of PM2.5 actually crosses the placenta, and that's how it enters fetal tissue. Now, the placenta is a critical player itself that's affected by wildfire smoke and related to healthy fetal development. The placenta is kind of amazing because it's metabolically active. So it provides nutrition, it removes waste. It also has this incredible and really unique ability to adapt and change actually in response to demands from the maternal side or the fetal side and in response to changes in the environment. So when the placenta is affected by toxicants or exposures like PM2.5, this again can result in inflammation and changes actually in how genes within the placenta that are really important in this nutrient transport are expressed. Now, this is really important. These changes, epigenetic changes, are really important because this sensitive time of fetal development can actually affect a child's growth across their lifespan, not just in the neonatal period. Now, other chemicals that are found in wildfire smoke, think about things like flame retardants or industrial solvents. They're all known to be toxic to development in the fetus, and they're all known also to accumulate in the placenta. So the scientists are still really working to understand what are the clinical effects of these prenatal exposures, but we've known really for a very long time that protecting healthy brain development is a really critical part of children's health. And protecting healthy placental function has long been recognized as really critical in healthy pregnancies and birth outcomes. So let's talk just a little bit more about preterm birth because I think it's such an important outcome to understand and to emphasize when we go out and talk about this in the field. I don't think, this is my opinion, that it gets enough attention or airtime for how important it is in terms of a climate-related exposure. So when we're talking about preterm birth, this is really any births before 37 weeks. When it comes to wildfire smoke, the risk is probably the most heightened when the exposure occurs in mid-pregnancy. Now, being born too early is important in that moment because it heightens your risk of dying in the newborn period. It raises your risk of needing to be readmitted to the hospital or the neonatal ICU. Premature babies have a heightened risk of challenges with things like feeding and growing, and they have more jaundice compared to babies who are born full term. But also, it has this really important effect on children's development across a lifetime. That's not to say that there aren't many perfectly healthy, formerly preterm babies out with no sequelae, but the risk is raised of challenges with impaired cognition, of reduced growth in childhood, of developmental delays, of cardiovascular disease, of a diabetes in adulthood. So if we think about in the US already, the rates of being born preterm or too early are already affecting like 10% of our births. And the estimates vary, but if you look at the numbers, that's probably somewhere around 300 to 400,000 babies in the US annually. So if you take a factor like wildfire smoke that increases these outcomes and these numbers even just a little bit, it could have huge implications for public health, not just immediately when those babies are readmitted to the hospital, but when they grow up and reach the early education and care system, when they reach the school system, when they reach the adult medical care system. And then you take other exposures like extreme heat, which also drives rates of prematurity, and these exposures occurring together. It's a really important outcome to understand, and again, points to how important and valuable it is if we think about protecting pregnant people and raising this issue as one that's really important to understand when it comes to climate and health. So we can talk a little bit about wildfire smoke and how it affects birth weight. So birth weight is a really important population level predictor, both of infant mortality and morbidity, and again on those adverse outcomes that can happen later in life. Low birth weight is generally considered babies who are born less than 5.5 pounds or 2,500 grams, regardless of gestational age. So a baby who's born full term at 40 weeks or 38 weeks, who's 5.5 pounds would be considered low birth weight. So these babies have a heightened risk of feeding, of gaining weight. They have more trouble fighting infections, of maintaining their body temperature. And then in the future, again, lifelong implications, heightened risk of cardiovascular disease, cancer, and other health outcomes. So there's scientists that are really working to understand how wildfires might affect fetal growth in probably really complex ways. And again, this is a place where the heterogeneity, all the differences that make up what's in the wildfire smoke can make it challenging to study because it truly varies from fire to fire. But it is increasingly clear that there's an effect of smoke exposure on fetal birth weight. Shifting to talk about respiratory disease, Lung development is an incredibly dynamic process. It begins in the earliest days of the prenatal period. It actually continues into adolescence, which is amazing. So think about how long that system is sensitive as it develops. So children actually, they breathe more quickly than we do. They inhale more air for their body weight, like we talked about. And so these exposures actually end up resulting in kids who have more exposure to wildfire smoke having an overall heightened risk of emergency room visits for asthma. This is thought to be particularly due to the exposure to increased ozone from wildfire smoke. Kids also have more upper respiratory tract infections and pneumonia and bronchitis. Now, in the US, actually, there's more than 2,000 ER visits annually for asthma related to wildfire smoke, which I think is a pretty incredible number. So now, next, let's think about wildfire smoke's effect on learning, because I think this is another one that maybe doesn't have as much understanding in the public or as much discourse in terms of why it's important to protect kids. So there's a nationwide study that looked at wildfire smoke exposure on the year leading up to a test. And they found that smoke exposure, particularly on school days, actually really significantly decreases student test scores. And the more smoke the kids were exposed to, the lower their average test scores. So not specific to wildfire smoke, but when we think about PM 2.5 again and being a major component in wildfire smoke, there's also many documented links between neurodevelopmental effects. So ADHD, autism, impaired school performance, and decreased memory. And then let's dive into some of the indirect learning losses that happen as a result of school closures and student displacement. So one of the strategies that schools, understandably have to use when air quality is poor from smoke is to close. And a lot of times they're making this decision because they don't have the air filtration infrastructure in place. And there's understandably very valid concerns about kids' smoke exposure, especially when they're traveling to and from school or they're on buses and they're walking. But for a lot of kids, this could mean staying home in homes that may not offer additional protection beyond being outside. And then if we think about lower income students or students who have working parents, this could also mean really varying levels of adult supervision for kids when they stay home if parents have to go to work to maintain their jobs. And then thinking about also disparities in who has access to remote learning and who is affected by meals that would have regularly been provided for school breakfasts and lunches. And we saw during COVID how important actually just being in school is for the social benefits of peer group and play and in-person interaction. The indirect learning losses from school closures are really important, I think, to dissect and understand because we think about schools closing and it's sort of ending there. But these displaced students then have to go and often register in new school environments. And so they have disruption of their routine and have to learn a whole new place. And then the host schools are actually experiencing really big changes too to their routines and to their operations because they're accommodating the students who are displaced. And then there's sort of the trauma that all these students and staff are going through as the wildfires are occurring, just from witnessing the fires and witnessing the evacuation or destruction of their homes. And so the effects on adults is really important, both in terms of those adults, but also, the stress and anxiety that they're feeling, understandably, really affects the ability to show up and provide a stable learning environment for kids. And then really this disruption in learning loss and missed school days can really widen achievement gaps, particularly in underserved communities that may be less positioned to rebuild quickly, to remediate quickly. And these temporary relocations and school closures delay instructions. This affects, again, like we talked about, thousands of students, so widening these inequities. There's also this concept out there of adaptation fatigue. So we just got over COVID. The schools just recovered. We got back to normal. The kids are thriving. And now the staff, the students, families are struggling to adapt to yet another really major disruption in learning. And then, just the additional strain on staff who are dealing with, understandably, their personal issues and losses, the loss of their homes, destruction, loss of pets, loss of family members, while still needing to support kids through the crisis. And all this, higher load, higher emotional load can understandably lead to a risk of burnout and anxiety and depression among people who are taking care of young kids. So one concept that we talk a lot about at our center is how interconnected all these influences from developmental environments are. And one of the big ones to highlight here, I think, is the interactive effect of stress and pollution. So both of these are known on their own to be triggers of inflammation, as we talked about. But when they combine, so all the stresses that we just talked about with these indirect school closures, they can really cause even greater and longer lasting spikes in children's inflammatory responses. And this is again really important in affecting their risk of these lifelong health conditions like heart disease, depression, and cancer. And so if we really want to make sure that all kids are thriving in environments that are supporting their well-being, we really have to think about strategies not only that are improving their air quality, but that are also lessening psychosocial stressors, especially in communities that are facing the greatest disadvantages. So the neighborhoods where kids are living and playing and learning have a significant bearing on the quality of the air that they breathe even before wildfires happen. And this is true both indoors and out. And because really as a result of long-standing discriminatory zoning and lending practices, that both historical but also current, there's a much higher proportion of Black, Hispanic, and low-income children who are living in neighborhoods with lower quality air even before the wildfires and substandard school buildings and housing compared with white families and higher income families. And so these neighborhoods are disproportionately zoned to have heavier commercial and industrial uses. And so families are exposed to higher levels of other types of outdoor air pollution on top of the effects of current and wildfire smoke after the fires occur. And so when we think about targeted strategies, we have to address these inequities in zoning, in housing, in schools, and in communities. They're really critically important to improving public health, and they can have really broad benefits for kids. So when we think about developing, what's the strategy? How are we going to protect people, young children, from wildfire smoke during pregnancy and during early childhood? We have to think indoors and out. It's a really critical opportunity to get kids off to a healthy start. And so all of us, whether it's policymakers, healthcare providers, whether you're a community leader or a caregiver, I think we can all step in and advocate for a range of solutions that are already available and, as I mentioned, already being implemented in communities. We think about these in three categories. The first is protection. So what are some steps, and we'll get into each of these in more detail, some immediate actions we can take now to reduce the harm when these wildfire events occur and to protect kids? Second is how do we adapt? How do we think about allocating our resources towards improving current systems and services and infrastructure that aren't set up to withstand wildfires or to recover from them? And then third, we always have to think about prevention and addressing the root cause of why wildfires are increasingly frequent and increasingly severe, and that's limiting the burning of fossil fuel. So let's talk about some steps for protection. So when air quality levels aren't safe, infants and kids, particularly the youngest kids, many people know are unable to wear masks. And so they really should avoid being outdoors and they need to have access to indoor spaces with clean air. It's really important that we as healthcare providers help to activate really localized air quality alerts. And we have to make sure that they're reaching people who are pregnant and people who are caring for infants and young children. So the AirNow website is a smartphone app. It partners with there's many multiple national, tribal, state, local agencies, and it communicates about air quality in any given area of the US. And we'll talk about different levels in a minute, but if the air quality index is red or purple or orange for more sensitive groups, including kids, it really should trigger us to take action. This should include wearing N95 masks if you're outside or staying inside in clean air, keeping unhealthy air out of indoor spaces, and preparing to evacuate if we need to. I think as pediatric and prenatal care providers, we can really have a role in counseling patients that these alert systems exist and advising them on what they can do when the air quality is not safe. The AQI is a composite measure. It looked at five of the major pollutants in the Clean Air Act. So, you may hear people say you have to take it with a little bit of a grain of salt. It doesn't account for some of the important components of wildfire smoke. So it'll account for PM 2.5, but not for things like volatile organic compounds or heavy metals or plastic. So it doesn't tell a totally complete air picture. So the AirNow app has a little smoke icon in the bottom corner, and if you click on it, you can see the AirNow fire and smoke map. So this is a screenshot of the map from June 3rd, so earlier this week, and this is a map that the EPA makes in partnership with the Forest Service, and it's the most comprehensive information out there about wildfire smoke and air quality. You can also view it on the web, or you can see it on the AirNow map, as I mentioned. It shows actually what your air quality from particulate matter 2.5 is. That's again the key pollutant in wildfire smoke. It also provides sort of a forecast about whether your air quality is expected to get better or worse. It'll tell you about fire locations. It gives smoke forecast outlooks. And again, we really need more research to understand what's in the air after wildfires and for how long, and figuring out a way to measure it, more completely. But I think for now, this provides some really good information. There's experts vary in advice, but many advise wearing a mask when AQI readings, the air quality index readings, are 40 and above. So 51 to 100 is generally considered a moderate AQI, again, with the index's limitations. We really need to make sure that, especially for individuals close to a fire, that there's masking available for a month after the fire, especially for pregnant individuals and for children who can wear a mask. This includes an area of about 100 miles within the fire, around the fire radius. We also need to make sure, like in situations where we need masks, we have to note that these are not designed for little kids' faces, so they can't be totally relied on for protection. But there's, I think, an excellent Wirecutter article that goes over which types of N95 and KN95 masks are easier to adapt and fit to young kids' faces. And we, again, want to make sure that they have that N95 rating or higher. Interestingly and important to know, N95 masks don't protect against gases, so they only protect against particulate matter. So if you're going to be outside in an area that's close to a burn site, or you're going to be outside for a prolonged period of time, most experts recommend a P100 mask. So these are the ones with the little round multi-gas cartridges on the side. You can buy them in many hardware stores. You can buy them online. So when you're deciding about your mask choice, among all these different choices and how long to mask and if you need to, we think about generally exposure over time and proximity to the burn site. So the longer the exposure is going to be and the closer proximity to the burn site that you're going to be, both of these things should factor in together. So the longer you'll be out and the closer you'll be, the more you should sort of consider wearing one of these higher levels of protection. So next is thinking about filtration. So if you happen to have central air or heating in your home or in a school or in a childcare facility where you have the ability to affect filtration, upgrading the HVAC filters to a minimum efficiency rating or MERV of 13 or higher is recommended. So MERV ratings basically signify how effective an air filter is in lowering airborne particulate matter, and it's determined by the smallest particle size that the filter is capable of trapping in microns. It's also recommended that you want to change your filter right after a wildfire because the smoke can really easily clog the filter and affect its performance. There's also, if you're very close to the burn site in close proximity, or if your home's been affected, or your daycare or your school's been affected by ash or soot, there's air purifiers, portable air purifiers called HEPA air filters. And these can also be combined with an activated carbon or activated charcoal filter. And these, again, the HEPA filter will get the particles, and then the activated carbon filter will get the gases that we talked about. Um, there's some limitations to the activated carbon. They don't have a lot of carbon in them generally, and so the filters saturate really quickly. And when that happens, they don't capture gases any longer. It's also really hard to predict when they're going to saturate because it depends on a lot of different factors. They're a lot more expensive. So, in most cases, they're probably not necessary, again, unless you're close to that burn proximity. But all of the portable filters, just like the MERV 13 central air filters, need to have the filters changed regularly. Another one is thinking about controlling indoor dust. Again, because we talked about these particles being aerosolized and everything that they can hold on to, you really want to avoid tracking in soot and ash from outdoors. So cleaning surfaces with a damp cloth, taking off your shoes. Don't vacuum unless you have a vacuum with a HEPA filter that's going to remove particles rather than kicking them up and aerosolizing them. And make sure that we're measuring air quality in the places where little kids are spending time. Most of us spend more than 90% of our time actually indoors. And for children and people during pregnancy, it's probably much higher. So the indoor air quality makes a really big difference, even outside of these wildfire times. You want to make sure that you're finding an indoor air quality that tracks the particulate matter 2.5, in addition to those VOCs and carbon dioxide. Again, there's a lot of resources online for where you can find these filters and monitors. So next we can think about adapting. So how do we think about focusing resources, systems, services to improve our infrastructure? I really believe that schools and places where young children and infants are spending time need to be adapted to be clean air rooms that can provide protection during these wildfire events. First is making sure that we're limiting how much of that outdoor air is getting in, closing the windows, and sealing up any really noticeable cracks so that the infiltration can't happen. And then, if possible, we want to avoid using whole house fans or swamp coolers because those will increase the amount of air that's brought in from the outside. So, in the case of wildfires, it's actually a time when you want to reduce ventilation. And again, a lot of these measures are going to require outside investment, in many cases, probably from the state. So there's an amazing researcher who I've learned a lot from named Joe Allen, who has a healthy building center at the Harvard Chan School of Public Health. And he says that you can ask these three questions as a guide in determining what level of protection you want to take after a fire. So first he says, did you see it? So if you saw the fire or you still see it, or you see visible dust or ash, you probably should take extra precautions. Can you smell it? So if you're still smelling smoke or you smell that fire smell, that's usually from off-gassing of VOCs, those chemicals that have been absorbed in the home or in your school. And then finally, can you sense it? So if you have a portable air quality sensors and you're measuring PM 2.5 or total VOCs, it'll give you an idea of whether you're being affected or not. And so, these measures can all, vary depending on how affected a home, a childcare center, or a school was. The cleaning after fires occur is really important, and obviously children should not be included in the cleanup. But regardless of the distance from the burn zone, we recommend really watching out for symptoms of smoke exposure, anything from dizziness to chest tightness to burning in the nose or the eyes, even 5 days after exposure, because the delay can be that long in developing symptoms after you're exposed to an AQI of only 80, which is pretty easy to get to in a wildfire situation. So finally, prevention, where do we have the ability to advocate for regional, state, local policies that are all reducing pollution, limiting buses that run on diesel fuel and transitioning to electric when possible? And also enforcing regulations. This has been done in California to site new schools and then this one isn't in place yet, but I would love to see it, new childcare centers in areas that are further from major roadways so that those kids aren't experiencing higher levels of pollution before the wildfires start. And thinking about, where can we reduce our reliance on fossil fuel and how can we do that in the settings where we each work? And I think all these efforts are going to have to include community engagement and input and support and leveraging all the solutions that are available, including this conversion to cleaner energy. So in the last few minutes, I want to take a moment to tell you about the early findings that we have from a research project that's connecting climate change and early childhood development. Now, this research is being conducted by the Frameworks Institute. We're partnering with them, with the Center on the Developing Child, together with the Center for Climate Health and the Global Environment, or C-Change, at the Harvard School of Public Health. This is really exciting work because we're trying to understand a few key categories. Mainly, how does the American public think about climate change in early childhood presently? We look to see what's the media discourse around climate change and children. And then we were able, from this report, Frameworks was able to generate for us some emerging recommendations for how we can communicate about these things. And I thought it would be interesting to this audience as we all go out and talk about how important it is to connect climate change in early childhood. So the goal of all this is a new strategy, right? How do we go out and have really effective communications so that we're advancing a narrative that's really powerful, that gains momentum, creates public will, that all prioritizes children's health and well-being? So, how does the American public think about climate change in children? To do this, Frameworks did 20 interviews. They looked at a diverse sample of members of the American public during August 2024. And they looked at these interviews to identify what they call cultural mindsets. So, these are deep-seated ways that people think about climate change in early childhood. And they selected participants really across a broad range of the public. So, they wanted to make sure that they had a representative quota of parental status, of political views, of location, of age, of race. And, not totally unsurprisingly, people do not think about children in connection with climate change. It's just not something they bring together. When they do, they really focus on direct impacts of health. So those things in the moment. There's really not an awareness or understanding of all the long-term developmental impacts that we talked about today. So structural inequities and how they'll be worsened by climate change are also not well understood. And people think about how climate change affects caregiving, but when they think of caregiving, they're really just thinking about parents. So we're not thinking about all the other people that take care of children in the different spaces in their life. They also, people put a lot of responsibility on parents as being responsible for kids' well-being, but we need to name that the government also has a role to play. They believe that that's true, but they also believe that it's compromised by corruption. And then finally, solutions that help kids thrive aren't really front of mind for people. They actually focused on individual behavior change. So when you ask what you can do to help, they would name things like recycling, but not solutions that were specific to kids, like cleaning the air in spaces where kids spend time. So I thought the media discourse around children and climate change was really interesting. So Frameworks did an analysis of how often articles and posts about climate change mention kids, how often they mentioned child development, and how often they mentioned children's health. And only 4% of climate-related articles mention kids at all, and a much smaller percentage, so only 1.8% addressed both children's health and development. So they're really not being brought up in the discourse. And this is a place where we can all step in and change things. So the emerging recommendations from this phase one study, which will be followed by, in the future, work looking at what we can effectively do to mobilize productive mindsets is first, when you talk about climate change, talk about kids. Next is highlight the present impacts and the future ones, so the developmental impacts as well. Not, and again, like the impacts across the lifespan, not just the health risks that can happen in the moment. And then connect climate change impacts on adults to impacts on children's health and development. So, for instance, if your family is displaced during a wildfire and your caregiver is no longer able to work, they won't have financial resources to provide for your basic needs. That affects your nutrition, which affects your growth and lifelong health. And then we need to be really clear that there's marginalized groups that are being disproportionately impacted by climate change. And we also need to explain why, being as clear as possible to connect the dots for people around how discriminatory policies, historic and present, have led to these inequities. And whenever possible, actually giving specific examples of the policies to make it extra clear. And then finally, we need to, or not finally, almost finally, we need to shift responsibility for protecting kids from just parents to all of us, wider society, and what the government can do. And then talk about how people can be involved in solutions that affect the root cause. So many times the burning of fossil fuels was not named as either a problem or a potential solution when people thought about how they could protect children from the effects of climate change. So these studies and others were drawn on the work of many very, very smart scientists from around the country who all do incredible work around climate and wildfires and children's health. I have a couple of the references here, but I also, from the talk, I also encourage you to check out our wildfire brief on the Center on the Developing Child's website. It includes the full references for all the studies that I talked about today, if you're interested in learning more. And I really appreciate you having me here tonight and look forward to our conversation now.
Great. Thank you so much, Dr. Burkhardt. That was great. I really appreciate your kind of focus on some actual actionable items that we can take moving forward. I think we have probably just about 5 minutes for questions. I don't know. I didn't necessarily see anything in the chat. I'm not sure if
Yeah.
Emily had anything. If Oh, it looks like maybe Paul's
I'll
got a
I'll
question.
raise my
Yeah, Paul, go
hand.
ahead.
Yeah, thank you, Dr. Burkhardt, for the excellent presentation. Um, I was wondering whether there are any local epidemiological studies looking at communities affected by wildfire and any bumps in premature birth rates surrounding those wildfires, like an MMWR sort of report. Are you aware of any of those reports in the literature?
Dr. Walsh might know that answer better than me since he's local. I don't know the New Hampshire epidemiology or whether there's studies
No, I
locally.
just mean in the nation, out in California or even from Canada. Are there communities that have been studied that have looked at wildfires and then see a bump in premature births that then go back to the normal baseline after the air all clears?
Yeah, I don't think it's as clear as you're describing. That would be wonderful. But I think there's some really sophisticated methodology that I've been learning about that people are using where they use geospatial data basically to say where was the smoke exposure and over what time, and then what were birth outcomes during that time. And I think
Okay.
that's a lot of how they've been able to make the connection between when the smoke exposure occurs and
Okay.
when the heightened risk of
Yeah.
prematurity comes, with that
Yeah.
exposure in middle pregnancy. But I think that's the thing that I would be really interested to see, bigger studies come out of. Um, I don't know how much this is part of that particular study, but the LA Fire Health Study is a consortium of like 10 different universities that came together within 2 weeks of the LA fires to do a 10-year like outlook on health outcomes and exposures following the wildfires. So I'm sure and I hope that that will be part of that study. I know that there are some smart people who study birth outcomes that are involved, but it's pretty incredible actually that they were able to mobilize from philanthropic dollars within 2 weeks of the fires occurring and already have these community-led initiatives in place. So hopefully we'll have more information the next time we talk.
Well, I'm glad you said it was from philanthropic dollars because if it were federal
Yeah.
dollars, they'd get cut and take the rug be pulled out from under them. I also wanted to mention I signed on just as you were beginning and after the introductions were started, but I wondered whether anybody mentioned that there's air quality warnings today in New Hampshire, and we tend to think of New Hampshire as this pristine wooded state with always clean air, and we don't have it. Our ozone here in southern New Hampshire, where I am, is currently 90. I did look up the Air Now app as you spoke, and our PM 2.5s are 54, which put us in the yellow warning category today.
I'm always I think when you live in a climate like friendly world where people talk about this stuff all the time, we're like, oh yeah, the AQI in my area, like I always know what it is. But then I talk to, friends who do, a variety of other things who aren't aware that that app is even out there. And I don't think that we all necessarily need to be opening our smartphones every morning and being hyper alert on every clear day of what the air quality index is. But I do think that there's some reasonable awareness of what your air quality is and trends and when you might think of being more aware and when we might think of advising people. And like you said, maybe some of these situations where you can make the connection, well, the sky is blue and the sun is shining, but that doesn't necessarily mean that the air is clean. And so there might
Yeah,
be, space for, alerts from different stakeholders in the state, from different community groups about like at what level do we want to let people know, hey, just keep an eye on your air quality for the next week and make informed decisions about your indoor and outdoor behavior as a result, especially if you're in a group that's going to be more sensitive.
yeah. Well, fortunately, the weather reporters are pretty good about mentioning it, and the weather apps will also give the air quality warnings on them too. So at least it's a expected part of a weather report right now, which is great.
Yeah.
Um,
Your
yeah, it is.
oh, sorry, I was gonna say your comment that only 4% of the climate information contained kids really burst the bubble that I live in as a
All
pediatrician
right.
who's interested in climate. I was like, oh, that's so low. That
I
is
know.
it's really interesting. I actually have, if no one else has a question, I actually had a question. I don't want um, I was curious, and it kind of relates to what Paul was asking about. I was curious if you've known of any studies where people have looked at thinking about development outcomes, like the development outcomes from someone who's been exposed to tobacco smoke in utero to someone who's been exposed to wildfire smoke in utero. I mean, that's kind of a complex question to answer, but I wonder if,
No, I don't think that's out there. It may be. I would love to be proven wrong if somebody hears this and can send it to me. But I don't think that there's I think there's very little known about developmental outcomes around wildfire smoke exposure. I think also the heterogeneity of the smoke exposure makes it really, not to say it a third time, but like really difficult to study. And
Mhm.
so I think taking a lot of what we understand about PM 2.5 and saying, what can this inform about our thinking of wildfire smoke exposure? But I mean, in my like, I don't know, just sort of impression, it can't be any better.
Yeah. I mean,
It's going to be worse.
I certainly think when I try to think about something try to think about an analogy to this, I think about cigarette smoke and it no longer being allowed in restaurants, which is like something I remember like as a kid, my dad
Yeah.
adamantly making us sit in the non-smoking section, which I appreciate now and always did. But this I think it's just a similar example of like advocacy and legislation that made a significant change. And I always wonder if there's a bit if there isn't a good way that we can kind of make that connection in some of the work we do.
Yeah, I think, I don't know. There may be a lower lying fruit than we realize. I think actually in just saying wildfire smoke affects development, right? Like I think that for a lot of people, when you hear that it can, raise your risk of your baby being born too early and that that can affect their brain development and that can affect their development, their, cognitive, social, emotional development, I think that actually is we may not need as much data as we think, I guess is my gestalt. I don't know, I could be wrong, but I don't think that there's a widespread connection being made necessarily between smoke exposure and adverse neurodevelopment, but I think that we know to some degree that the prematurity part alone can heighten that risk.
Yeah.
So I think the connection between climate and health alone is one that we could talk up more. And climate and children's health, I think making that connection. I know from my own anecdotal experience when I just talk to people and say climate change is affecting children's health in these ways, people are like, really? Wow. And then they buy in pretty quickly, when you show the health outcomes. So but yeah, I totally agree with you. And it's one of those things now where what can we learn from what we've done successfully? I think heat is the other really big example to me there. People do not, I think, widely make the connection between heat and development. And they're really, really tightly connected. And extreme heat is affecting a lot of kids' development, and we need to draw some attention to that.
Yeah, thank you. Yeah, totally appreciate that. Think we're pretty much out of time. So just want to, I don't think there are any more questions. I didn't notice any in the chat. So thank you again, Dr. Burghardt, for coming
Yeah,
and speaking
thanks for
with us.
having me.
It was great. Really appreciated it. And I just before we go would ask anyone who's watching live or ends up watching the recording if you enjoyed the content that was provided tonight to think about going to the New Hampshire Healthy Climate website and supporting us by either by joining along or donating to the cause. So thanks again, Dr. Burkhardt, and thank you everyone for joining in.